So this will be part two of group counseling. So screening, a professional counselor screening, uses a screening process in order to determine who is appropriate and who will not be appropriate for a given group. Ho- Hostile individuals who act out aggressively, persons who are actively suicide or homicidal, paranoid clients, those who are totally self centered, or psychotic individuals. Psychotic implies that the person is not in touch with reality, are not appropriate for most counseling groups. So, hostile individuals who act out aggressively, persons who are actively suicidal or homicidal, paranoid clients, those who are totally self centered, or psychotic individuals are not appropriate for most counseling groups. Remember that psychotherapy groups would be like the tertiary part where there's a serious or severe long-standing issue. So remember that psychotherapy groups focus more on individual concerns, deal with remediation of more serious pathology, and are of longer duration. Clients who are very verbal, open to feedback from others, and believe in group therapy often make excellent group members. A screening for group members can be done in a group or privately. Private screening interviews are not as cost effective or as time efficient as group screening. Many group leaders feel that private screening sessions are superior in terms of counselor client interaction. A pre group interview for screening and orientation can be very beneficial. In essence, the client's needs must match the goals for the group. Ethical standards and guidelines do not, however, discuss specific selection processes. So, ethical standards and guidelines do not tell you specifically what the selection process must be. That's up to the counselor to decide based off of the group. Um, in essence, remember the client's needs must match the goals for the group. An individual screening interview allows the client to voice concerns regarding what he or she wants from the group and the procedures that will be implemented. Some of the literature emphasizes that screening is a two-way process, i.e., the leader can decide whether the member is appropriate, and the member can decide whether the group and the leader are appropriate. Individual screening modalities also can serve to build trust. Irvin Yalom feels that the main factor in selecting participants for a group is that members can feel cohesive. A sense of we-ness is essentially what cohesive is. Research indicates that high denial, low motivation, and low intelligence are associated with premature termination from group therapy. So, those who are most likely to terminate from group therapy prematurely would be those with high denial. They can't see what they're doing wrong. Low motivation, they have no will or desire to change, and low intelligence. Generally, a closed group will have more cohesiveness or unity since the membership is more stable and members get to know each other. So the membership is more stable because new members are not joining, and that allows for members to get to know each other. Genuineness, which is also known as congruence or authenticity, is advisable in all therapeutic settings. Generally, persons who are similar will sit next to each other. In a group where the members are very similar or alike, the group composition displays what is known as homogeneity. So, Weight Watchers would be a case in point. Group Groups which have homogeneity are said to be homogeneous, since everybody really has the difficulty or concern, like i.e., weight control in this case of Weight Watchers or alcoholism in AA. People often feel a greater degree of welcomeness or cohesiveness when there's homogeneity in the group. Some experts are convinced that homogeneity in terms of intelligence and level of development is desirable. In children's groups, this would mean an age span of no more than 2 years. So, i.e., 10 to 12, 9 to 11, 5 to 7. So, you wouldn't want the children's age spans to be more than 2 years for there to be similarity or homogeneity. A heterogeneous, a heterogeneous group or a group which has heterogeneity has members who are dissimilar. When you combine people, you discover that people can learn from each other, and this is said to facilitate personality change. Process focuses on the process or manner in which the communication transpires. So remember, we have content, group content, and then we have group process. Process focuses on the process or manner in which the communication transpired. Content focuses on the material. So the example used is, which statement made by a doctoral level counselor is illustrative of a leader focused on process rather than product. Product would be the content or material. Jim seems more relaxed today. This sounds like they're talking about the content. Sally seems a bit self-critical this evening. That's product, content. I hear a lot of sadness in Betty's voice, product and content. You wince whenever Jane raises her voice. That is manner in which the communication transpires. So that the last, you wince whenever Jane raises her voice, that would be focusing on the process, the manner in which communication transpires. Groups promote the concept of universality, which suggests that we are not the only ones in the world with a given problem. Universality is we are not the only ones in the world with a given problem. Universality can also be referred to as mutuality. They're interchangeable. Universality and mutuality is just knowing that we are not the only ones in the world with a given problem. The classic study regarding leadership styles was conducted by Lewin, Lippitt, and White in 1939. The study demonstrated that leadership styles do make a difference. Autocratic or authoritarian, autocratic or authoritarian democratic or participative, or laissez-faire fashion. So it says in this famous study, 10 to 11-year-old children met with an adult who behaved in an autocratic, which is authoritarian, democratic, which is participative, or laissez-faire fashion. So the French term laissez-faire implies that group members can do as they please without leader interference or direction. So that would be like complete non-directive style, like a client center. They're just doing how they want and they're controlling the situation. So children display the best behavior when treated in a democratic fashion, while aggressive behavior occurred in response to the other two leadership styles. The study revealed that hostility was 30 times greater in autocratic groups than it was for the other two. So when the study showed that kids between 10 to 11 responded best to a democratic participative style of parenting or leadership, while autocratic, which is authoritarian and laissez-faire, resulted in aggressive behavior, and the aggressive behavior was 30 times greater in the autocratic groups. Do not, however, assume that the democratic style is always best. It is not. The autocratic mode seems to be superior when an immediate decision is necessary. When a group has made a decision and is committed to it, the laissez-faire style is usually the leadership model with the most merit. So, generally speaking, democratic is what people would, or those children, best responded to. But if it's time for an immediate decision, then authoritarian style would be best for the group because, hey, we got to get this done. Now we need structure, we need authority. If a decision has already been made and committed to, then it's like that laissez-faire is best because it's like we all know what we're supposed to be doing. We've all agreed on it. We all want it. There's no reason to make a big deal out of nothing. The charismatic style in which the leaders oh there's another the last style is the charismatic leadership style, in which the leader uses his or her personal power, charisma, and attractiveness to foster facilitation. So, a legit criticism of the famous Lewin, Lippitt, and White findings would be that the study was not a counseling group, but rather an after-school activity group, and all the leaders were male. On rare occasions, your exam might mention impersonal leaders who are distant but aggressive. So they're impersonal, they're distant but aggressive. Energizers, leaders who emotionally stimulate group members and are charismatic. Managers, or leaders who exert executive control. Providers are very high in caring. Effective leaders have discovered that modeling appropriate behaviors improves group participation, even when the members are resistant. So, modeling the appropriate behaviors will improve the group's participation. Co leadership reduces burnout and helps ensure safety. Co leaders work best when each leader has a similar philosophy and group style. It is generally accepted that it is best for co leaders to physically sit on opposite sides of the group rather than next to each other. Co-leadership is helpful when one leader is experiencing countertransference. If you have an issue that is unresolved and it is having a negative impact on your intervention, i.e., you're experiencing countertransference, then your co-leader can deal with this particular person or issue. Transference refers to a client's issue, while countertransference implies that the helper has issues that are interfering with the treatment process. If there are problems between co-leaders, it is best if such difficulties are aired out in a format that models effective conflict resolution during the session rather than pretending everything is wonderful. So it's actually saying don't hide it, but show and use that as an opportunity to model effective conflict resolution. And you would do that in front of the group. Gerald Corey, he is big and has wrote extensively on group therapy. He believes participation in a therapeutic group and participation in a leaders group, even if the individual is well educated and is licensed and certified, is necessary for an effective group leader. So, to be an effective group leader, one should participate in a therapeutic group and participate in a leaders group. Specific training in group work is necessary in order to become a group leader. A group practice course is generally required prior to taking a licensing exam. A training group for future group leaders is one solution to this dilemma. A training group is composed of leader trainees, and unlike a therapeutic group, it is focused on leadership skills. So, you need specific training in group, which would be necessary in order to become a group leader. A group practice course is generally required prior to taking a licensing exam. A training group for future group leaders is one solution to this dilemma. So, somebody creates a training group for the people who are interested in becoming group leaders, because the training group will be composed of leader trainees, people who want to lead groups. And unlike a therapeutic group, it is focused on leadership skills. Irvin Yalom has gone on record as saying that self exploration, i.e., personal therapy, is generally necessary for potential group leaders to help them deal with issues which could cause countertransference. So most experts, um, most experts would agree that an effective adult counseling group has 5 or 6 to 8 members. So the ideal ideal group would have about 8 adults. An adolescent group might be slightly smaller, perhaps 5 or 6 members. Some experts feel that a group conducted over a long period of time, say 6 months, can safely have as many as 10 members. But adult counseling groups, the ideal number is about 6 to 8, while in children and teens, it would be 5 to 6. In children, it would be 3 to 4. So, ideal groups for adults, 8. We can go up to 10 if they're for long terms, 5 to 6 for teens, and 3 to 4 for children. 1.5 to 2 hours is sufficient for adult group work. 1.5 to 2 hours is the ideal time for adult group work. Since a children's group will have shorter sessions, it is best to rely on more frequent group sessions. So with children, you'll have shorter time as far as the therapeutic sessions, but you'll meet more frequently. According to ACA ethics, safeguarding clients is a must in the sense that the adept leader takes reasonable precautions to protect clients against psychological, emotional, and physical trauma. So, according to ACA ethics, safeguarding clients is a must in the sense that the adept leader takes reasonable precautions to protect clients against psychological, emotional, and physical trauma. Hence, although group confidentiality a hint. Although confidentiality is desirable, leaders should inform participants that they cannot guarantee confidentiality. Lack of confidentiality is a risk of group intervention. So, in terms of group risk, an ethical leader will discuss them during the initial session with a client. The purpose of the group, the risk involved, and the leader's qualifications. An adept group leader will attempt to safeguard clients against risk, want to reduce risk and dangers. Professional counselors should give clients information regarding the group so the client can make informed decisions regarding whether or not the group is appropriate. That information would be the purpose of the group, the risk involved, and their leader's qualifications. This practice technically is known as informed consent. Ideally, informed consent occurs during screening before the initial group session, although in the real world, this is not always possible because you don't always get to screen. So if it happens during the screening process, the informed consent, and it also happens during the initial session. When a client is required to go to counseling or therapy, it is known as mandatory treatment. A quick quip: when a client is referred for treatment and is not enthusiastic about their intervention, the term reluctant client is usually applied. When ground rules become the standard of behavior, then it is known as a norm. So when ground rules become the standard of behavior, then it is known as a norm. And we learned earlier that a norm is pretty much the expected behavior of the group. It can be explicitly stated or implied. Oh my Jesus, that thing gonna kill me, that moth. The term ambivalent transference is a psychoanalytic notion often thrown out in multicultural circles, which suggests that a client will treat a therapist with ambivalence as he or she would any person viewed as an authority figure. So, ambivalent equals mixed feelings. So, the term ambivalent transference or mixed feelings transference is a psychoanalytic notion and is thrown out in multicultural circles, which suggests that a client will treat a therapist with mixed feelings and treat them as if he would any person with that's an authority figure. So blocking is a term often used in group work. Blocking occurs when a leader uses an intervention to stop or block a negative or counterproductive behavior, which could hurt another member of the group. So blocking is done by the facilitator or leader, and it is to stop a negative or counterproductive behavior. And the goal is to stop it so that way it does not hurt another member of the group. So remember, group norms refer to the range of acceptable behavior within a group. Um, Group norm is the acceptable behavior within the group. Norms are the written and unwritten do's and don'ts of the group. So it's the expectations. Group dynamics refers to the study of the interrelationships and interactions between group members. Group stages, cohesiveness, leadership style, and decision making are prime examples of group dynamics. Any factor that has an impact on the group can be referred to legitimately as the dynamic. So any factor that has an impact on the group, whether that be the cohesiveness, the leadership style, the group stage, the decision making, all those are the group dynamic. Okay. The hot seat. The hot seat is a term popularized by Fritz Perls Gestalt therapy groups. A person who is the target of the therapist's interventions in the here and now is said to be on the hot seat. The structuring of the group is determined by the presence or lack of structured tasks or exercises given to members by the group leader. So the structuring of the group is determined by the presence of or lack of structured tasks or exercises given to members of the group. An important point: often, when an exam uses the term structured group, not to be confused with the term group structure, it connotates a group which focuses on a given theme, such as a group for veterans. So, a structured group is often has structured tasks or focuses on a given theme. The word dynamic means the group is always changing. The group dynamic, the factors that comes into play, but these factors will always be changing. The idea of the operational definition is that another person can duplicate your actions, i.e., the exact steps for therapeutic research or testing purposes. Behaviorists have emphasized the notion of operational definitions more than any other therapeutic schools. Oh, okay. So this is basically talking about defined in an operational manner. So key here was the word dynamic means the group is always changing. But then it brought up another word which is our common statement is defined in an operational manner. So it's saying in order to operationally define something, you must demonstrate the concrete steps necessary to eliminate the concept. So to operationally define, say, positive reinforcement, you would first know how often a behavior is occurring. Then you might give the client a reward every time he or she performs a desirable behavior and tabulate the fact that the behavior is occurring more often than instituted before you instituted the procedure. So to operationally define the action of Oh, yeah, that's another example. So, the idea of operational definition is that another person can duplicate your actions for therapeutic research or testing purposes, which is popular in behavioral for behavioral therapists. So often goals are defined, yet they are too vague. So experts firmly believe that a common weakness in many groups is a lack of goal setting. I seen this on the other one. So experts firmly believe that a common weakness in many groups is a lack of goal setting. Often goals are defined, yet they are too vague. So a group leader who utilizes an abundance of group exercises is running a structured group. Um, an assertiveness training group would use a lot of structured exercises versus a self help group would not use structured exercises. Some theorists object to the word unstructured in group work because a group cannot not have structure. So it's pretty much saying they oppose it because it can't be completely true. Like there's going to be some type of structure. Some research indicates that structured exercises in the initial stages of the group can facilitate better communication. So, an unstructured group may have like ice icebreakers in the beginning to facilitate communication. Um, but ultimately, it's going to be unstructured because there's not going to be a whole lot of tasks and exercises. All right. So, in some literature, group cohesiveness or we-ness is known as group unity. The unity is actually a feeling of belonging, oneness, or togetherness. And then outside of that question, we learned that a sociogram is simply a pictorial account of a group which serves to diagram member interactions. So, a sociogram is a graphic representation of social links that a person has. So, a sociogram is like you can take all the members in the group and then you kind of make a diagram of the members' interaction. So this person talks to this person, seems to be fond of this person. You start creating the links through a graphic representation, and that's social links. So then we learned Karpman's drama triangle, which is used most often in conjunction with transactional analysis, TA, as a teaching device to illuminate the roles of persecutor, rescuer, and victim in interpersonal relationships. So we know that in Cartman's drama triangle, that which is associated to TA, that was the example where if a man hits his wife and then he starts crying and then he says, "Oh, well, I always have to do the cleaning. I'm just so overwhelmed." That would be a perfect example of Cartman's drama triangle because in that he's played the role of the persecutor by slapping her, the rescuer by comforting her, and then the victim by crying and saying that it's essentially her fault. And that happens in interpersonal relationships. So then we learn of the transition stage. The transition stage is the group stage which occurs after the first or so called initial stage. And so the first stage is the initial stage. In the initial stage, members are acquainted and learn norms. So it's just setting the expectations and getting to know one another in the initial stage. In the second or transition stage, members are often judgmental, resistant, or involved in a struggle for power to establish a hierarchy or pecking order. And then after the initial stage comes the transition stage. You have the initial stage, the transition stage. So the initial members get acquainted and learn norms. In the transition stage, members often are judgmental, resistant, or involved in a struggle for power to establish a hierarchy or pecking order. So we will start going over group members and their roles. So we have the energizer, scapegoat, gatekeeper. These are common roles in group settings. We also have the follower, the interrogator, which is also called peeping Tom, the harmonizer, who's also a conciliator. So the ones that we're about to go over right now is energizer, scapegoat, gatekeeper, follower, interrogator, harmonizer. In counseling, the term reactive means that a given condition is the result of environmental stress. So reactive means it is a result of environmental stress. I'm reacting from stress. So this is separate. Hence, the reactive schizophrenia would imply that the person experienced a psychotic episode following a traumatic experience. This would be in contrast to an individual who who was seemingly always schizophrenic, and the pathology could not be traced to a given set of circumstances. So you have the schizophrenic who is just always that way, cannot be traced to a given set of circumstances. And then you have the reactive schizophrenia or reactive schizophrenic who has experienced a psychotic episode following a traumatic event. So maybe somebody loses a baby, they start displaying signs of schizophrenia. That would be reactive, is based off that given condition or environmental stress. So going back to group roles, the energizer stimulates enthusiasm in the group. They're like the come on folks, this will be a lot of fun. And besides, we'll really learn a lot. That's the energizer. Energizer brings enthusiasm. We have the scapegoat. The scapegoat is the person everybody blames. He or she is invariably the target of severe anger and hostility. It would be like, look at Marv. We all agree that if it weren't for you, we would have solved the problem 2 weeks ago. The gatekeeper tries to make certain that everyone is doing his or her task and is participating. So, gatekeeper is trying to make sure that everybody else is doing the task and is participating. They're concerned about everybody else instead of themselves. No, this person may secretly or unconsciously want to lead the group and could even attempt to establish norms, like start making up rules. The danger or trying to set the tone, like the behavioral tone. The danger is that a gatekeeper often does not work on his or her own personal issues. like I'm saying, they be in everybody else gatekeepers, be in everybody else business. Not they so concerned with making sure that everybody else is doing their work and low key trying to facilitate the group that they're not getting their work done. And sometimes they'll try and set norms. A group member who insists on asking other members inappropriate questions is known as a peeping Tom or an interrogator. So just think interrogators, police asking questions. The interrogator asks a never ending string of questions while the follower goes along with the rest of the group. The follower goes along with whatever the rest of the group thinks. From a personality standpoint, the follower is non assertive. Then we have a separate side little thing here. So, practicing excitation. Yeah, practicing excitation relates to Andrew Salter's conditioned reflex therapy, in which excitation or the practice of spontaneously experiencing and expressing true emotions, even negative ones, is seen as necessary in order to attain a state of positive mental health. So, from a personality standpoint, the follower is non assertive, sorry. And then going back, um, practicing excitation relates to Andrew Saltier's conditioned reflex therapy, in which excitation or the practice of spontaneously experiencing and expressing true emotions, that would include negative ones, is seen as necessary to attain a state of positive mental health. So, inhibition or constipation of emotions is seen as opposite of excitation. So if you inhibition or constipation of emotions, not being able to get your emotions out, would be the opposite of excitation, because excitation is like spontaneously experiencing and expressing those emotions. Like whatever it is you got to say, you're going to say it. And then the opposite would be inhibition or constipation. So Saltier said, however, in psychotherapy, we need have no fear. The diagnosis is always inhibition. So I guess he's basically saying in therapy you shouldn't have any fear. And if you do have fear, the reason is inhibition. So then we have the harmonizer role. That would be the conciliator. The harmonizer is the person who tries to make certain that everything is going smoothly. They want to make sure that everything is in harmony. So the gatekeeper, they're kind of more so like trying to lead and facilitate. Like they're so worried about everybody else that they can't do what they need to do, versus the harmonizer, they just want to make sure things are more so going smooth. Like there's peace. So everybody would pick on the scapegoat. Um, then we have the storyteller. The storyteller monopolizes a wealth of group time, telling endless, often irrelevant tales. One popular notion is that these roles relate to the person's pattern of behavior in his or her nuclear family, and if appropriate, the group leader can explore this hypothesis. So, the role that they play in the group is typically a role that they play in the family. So, an example used is a female group member is obviously not participating. A group member playing the what role is most likely to mention this and urge her to participate. So, that would be the gatekeeper, because the gatekeeper wants to make sure that everybody's participating and doing their work. So, additionally, we have the isolate role. The isolate is ignored by others. Isolates generally feel afraid to reach out or do reach out and are genuinely rejected. So they're either afraid to reach out or when they do reach out is rejected. The isolate is not the same as the scapegoat. Scapegoats receive attention, although it is not by any means positive. So scapegoats receive negative attention. They are always placed at blame or fault. Isolates, a negative group role, often referred to as the silent one, on the other hand, they receive little to no attention. They they don't even receive attention. They're ignored. So cohesiveness can stunt creativity or boost conformity, since members want to fit in and go along with the wishes of most other members. So cohesiveness, which is typically a good thing, just be mindful that it can boost conformity because members may want to fit in and go along with the wishes of most other group members. Then we have the word faction. Faction is a clique or a group of people within a group. You might, for example, have a faction which does not wish to go along with a certain task or group exercise. The sociogram, which represents social links, can help identify group factions. A faction also may be called a subgroup. So, a subgroup or a faction is just when people begin to make cliques. Role reversal is a common behavioral role playing technique. A client who is having difficulty communicating with another person in his or her life role plays the person with whom he or she is having difficulty. This valuable technique gives the group member a new perspective on the situation and allows the person to learn via modeling alternative ways of behaving. So, in a group, task roles help solve problems, aid in terms of goal setting, and keep the group focused are seen as positive. A key concept: group specialists classify member roles as task roles, maintenance roles, and self serving roles. Self serving roles will be identified as individual roles. A task role simply helps the group carry out information. Oh, sorry. A task role simply helps the group carry out a task. So that can be an information giver or clarifier. A maintenance role helps maintain or even strengthen group processes. Then the final category, the self serving role, is seen as negative. The person who falls into this category meets his or her own individual needs at the expense of the group. A person who downright refuses to participate or a person who criticizes or disagrees with others would be a prime example of a self serving role, um, identified as individual roles. An entire group could be classified as a task group or perhaps a task slash work group. A group of this nature focuses on accomplishing work goals. An athletic team would fall into this category of task group or work group, as would a quality circle employee run group attempting to improve a business. A group of very immature participants. Sorry. If you have a group of very immature participants, then the so called situational leadership style is recommended. Here, the leader tells members what to do and does not emphasize relationships among members. So that's situational leadership style. You have immature participants. As a leader, you are going to tell the group what to do. You are not concerned about the relationship among members in that situational leadership style. Maintenance really implies that the role maintains group interaction. Remember, maintenance roles and task roles are positive, self serving roles are negative. Maintenance roles support the group's livelihood and hence are seen as positive. Paul Hersey and Kenneth Blanchard point out that leader activities generally fall into task actions and maintenance actions. If a group member has low maturity, which is really a lack of achievement motivation, then the leader should use high task and low relationship behaviors. So their low maturity, which is essentially saying they have a lack of achievement motivation, low maturity, immature, they're just not trying to be motivated or not trying to achieve or focus on what the goal is. The leader should use high task, so high structured work and low relationship behaviors. Like let me help you focus and not be so concerned on that relationship. As maturity gets better, a high task and high relationship model is ideal. And when group members display very high maturity, then a low task and low relationship leadership format should be desirable. So if they have high maturity, low task, low relationship, low maturity, high task, low relationship. Task action leadership is said to be indicative of one way communication, i.e., the leader tells the members about a task to accomplish, while leadership behavior is said to be the result of two-way communication. So, task action leadership is one way communication. The leader tells the members about a task to accomplish. Relationship behavior is said to be the result of two-way communication. The leader provides emotional support for members. When you see the words task and maintenance on your exam, the concepts could refer to either a group member's role or the leader's role. Behavior. The other concept is conflict between group members can often be abated by having the leader prescribe a task on which all the members must work together in order to accomplish it. Group specialists defined role conflict as a situation in which there is a discrepancy between the way a member is expected to behave and the way he or she actually behaves. That's a role conflict. Conflict of interest, which occurs when a group member maximizes his or her needs and interests at the expense of someone else. So, conflict of interest is when a group member maximizes his or her needs and interests at the expense of someone else. And then role conflict is a situation in which there is a discrepancy between the way a member is expected to behave and the way he or she actually behaves. And we'll wrap that up for part two.